I'm Dr. Ariel Polanca, and you're watching The Step. Dr. McDonald, welcome to The Step.
Howdy. Thank you so much. It's great to be here.
It is so awesome to have you. And you're hailing from Connecticut.
Yeah. I flew out from Hartford last night, and again, super thrilled to be a part of this. Congratulations on your hosting responsibility. You're going to crush it.
Why, thank you.
I think it's just a great theme that you guys are developing. It's super cool to kind of talk about things that we don't really hear a lot of focus on in the physician industry space, and love what you guys are doing.
Yeah, I feel like we get to have these conversations, sort of one-on-one, like, us in Portugal, and when you're hanging out with physicians, and you get to have these intimate conversations that we don't propagate and that we don't spread. And that was something that we were hoping to do with this sort of space. And so I'm just really happy that you get to be a part of it.
Yeah, we're all on this huge educational journey. And I think, looking back, like the things that I really kind of hold onto as the most important moments of education in my life have happened on the sideline, right? Just kind of talking to a mentor, talking to a colleague about what they're focused on or what I should be focused on, or just sharing, kind of some of the behind the scenes moments that happen in patient care that, kind of keep us up at night.
Yeah, absolutely.
Yeah.
How did you decide to become an orthopedic surgeon?
Oh, gosh. I kind of had this general sense, like I think a lot of young people do, that I want to be in a space where we're helping people. It was really that generic. My dad was a doc, and I always say I kind of had a lack of imagination. I didn't know what else there was to do other than medicine. So that was a shaping influence for sure. And, I think all the old stereotypes are true with me that we hear about orthopedic surgeons, where you're, steeped in athletics, and you see, kind of the grit and the grace that goes on in the athletic space, and then the inevitable injuries, and kind of start to develop an understanding of what that means for athletes. And at some point in your trajectory, you're exposed to our space, the orthopedic space, and care, and kind of starts your wheels spinning.
Absolutely. And you were All-American football player, correct?
I didn't know this was a podcast on ancient history. That's, you're really taking it back there.
I am indeed.
So I don't over-position myself as an athlete here. For clarity, I was super fortunate, really, to land in a tiny high school where there was, 30 kids on the football team, and so all you had to do was show up. And then there was an incredible coaching staff there that I really, benefited from. And when I think back on like my athletic experience, it was so fortuitous. To be a kid, lanky, 6'4", 150-pound, teenager who finds himself just in the right space and the right time, with the right coaching staff and the right team, and in an environment where, it's so hard to be an athlete these days, just to make the team in so many communities. But back then that was not the case. And then, kind of one thing led to another, and found myself against all odds playing on a college football team. And there was never a moment where I was going to be playing on Sundays. It was very, kind of happenstance, luck of the moment, luck of the draw, landed on the right team with the right coaches. And, from that, just had this really shaping experience in my own life, and I think, for a lot of us, that's the draw to athletes and athleticism, and, all the entertainment that surrounds athletics. It's fascinating to kind of see how kids get there, right? Mm-hmm. And the shaping influences that athletics has on their life. There's so many motivating human stories there, and it's a wonderful reflection when I think back about just the luck that allowed me to participate in athletics. And, really in that part of our life, it's such a shaping part of our identity, right? As a young person,
How do you think it shaped you?
It just leaves this, profound mark on, the power of what surrounds you. I think every team has, a few neuromuscular geniuses that just are going to be all everything. But most teams and in most spaces are comprised of, average athletes who just are there, maybe to be a part of something personal. Maybe they can achieve a personal record or achieve a personal best, but really they're there because they want to be a part of something bigger than themselves, and I think, when I think back on my own experience, that was certainly true. I was just, I felt so privileged to be a part of something that was organized and surrounding this kind of commonality of goals, and I kind of, see that reflected throughout so much of what we do in medicine, right? There's just so many touch points in patient care, and we are privileged to sit in this space where athletes come to us with a medical problem, patients come to us with an orthopedic problem, and in that moment, there's this direct conduit to their future health and mobility that kind of comes through us. But really, if you kind of think about the whole arc of the patient experience, we are, one small moment in that arc, and it starts, with our whole healthcare team, who answers the phone, who makes the appointment, who sets up the space that, creates a clean, healthy environment to have this interaction. It's just, there's a myriad of ways in which, patients can have a great experience or a not so great experience, and we're, only one small part of that. So
yeah, absolutely correct.
I think a lot about, kind of the healthcare team, and I think for me that has direct lineage and roots back to my athletic experience, and just kind of really, like I said, as a young bumbling teenager, to kind of start to understand what a team means, and the power of a group of people, and trying to figure out where you can occupy space in that framework is, for me, a big part of athletics.
How do you work to curate that team? I mean, I would see you as the leader, as the physician. So how do you make sure that from the person answering the phones to your MA, to your surgery scheduler, how do you make sure that you are working as a team to provide the best patient care?
Yeah, I think there is, this analogy and this theme in orthopedics that, a lot of orthopedic surgeons are ex-jocks or are focused on athletic accomplishment, and I think there's some kernel of truth in that. And I think as surgeons, sometimes, at least through my lens of a former athlete, I kind of value that that surgical case as my game time, right? That's where we can, take these skills that we've developed and honed, and apply them, in a short, moment of time, with precision and concentration, and achieve this outcome, right? We can, in that moment, that's our big play, mm-hmm. right? But, most of what we do, I think, as orthopedic surgeons is less quarterback, less athlete, and more, as I said, part of the bigger team. Maybe a coach analogy would be a good analogy that I reflect on. What space do I occupy in my healthcare team? Certainly, there's an athletic moment, and that's in this very manual, physical subspecialty that we participate in. That's empowering and exciting. But I think a lot of what we do is more in an advisory role, right? And so that's true with our patient interactions, where, when I think back about what made for a great coach in my experience, it was certainly, as you said, someone who had a leadership quality, but they were also, educators, right? They were teaching us, maybe, what to do, or a game plan or a playbook, or how to execute certain tasks, and oftentimes they were teaching us, so much more, right? Just about how to integrate with people and how to communicate and how to have ownership, and then they were also kind of the person with the plan, right? And I think in healthcare, a lot of times that's what patients want from us. They want they want a plan, right? They want to know that there's, someone in charge who has a downfield vision of where this experience is going to go, and who can be there, leading the team around them, or at least integrated with the team around them to get to that common goal. You think about how many parts of that team there are. Again, in the patient experience, there's not only the ancillary staff that schedules and manipulates each appointment and creates that kind of narrative of week by week follow-up, but then there's all the allied health professions around us that I think in orthopedics we really spend a lot of our training kind of siloed away from that. And there's physical therapy and athletic training. It's such a huge part of what patients go through as they're recovering from injury or navigating musculoskeletal health. And it's really, I think, to try to answer your question, I try to stay connected to as many of those team members as possible. And I think it makes a huge difference. I've learned so much since my orthopedic training on this whole other sector of healthcare that really wasn't emphasized when I was being minted as an orthopedic surgeon, right? And so much to learn on how they, I always tell patients our timeline kind of comes in 6-week increments. That's like 1 unit of time in our specialty, and so much goes on in the patient's experience during those 6 weeks. So I think, to try to answer your question, trying to stay connected to as many of those team members as possible really helps me be a better coach for my patient.
And you said developing a plan, and I like that a lot. How do you balance you being the one developing the plan and also incorporating your patient into helping to develop that plan?
Yeah, that's great, because, I think athletes in particular make great patients because they're super motivated, right? They're used to having a goal and doing whatever they need to, be it training or nutrition or repetition to achieve that goal. And I think, not every patient we see is an elite athlete, but a lot of the patients we see are analogous to athletes, super motivated, right? Mm-hmm. And so I think finding ways to tap into what motivates that patient can be really helpful. It's one thing for me to have a plan of how I think this is going to go and how I want this to go. As you know, that is not always the way things go.
Correct.
And so, I think being able to forecast for a patient, this is what I see, 80% of the time has value. But then also, kind of balancing that other X% of pathways that start to, get off the main course, and how can I align with the patient's, calendar, with their motivational attitude to get people where they want to be. I don't always have the answer for that, but I think I try to figure out as I talk to patients, what motivates them, what is their goal, and a lot of times their goals, might be orthopedically unrealistic, right? And so there is kind of the ability to kind of have an orthopedic plan, but also to communicate it in a way that maybe we can break that 3-month pathway of healing down into small subsets and start to reframe the patient's motivation. What I want you to do this week is focus on this, and I know we both want to get to that point where you're back on the field, but let's try to break it down into small steps that are orthopedically realistic and manageable from a patient standpoint. You think about musculoskeletal injury, it's overwhelming for so many patients.
Absolutely.
Right? It's just this huge left turn in their life, and trying to reframe, this new reality for patients is, I think, a huge part of what we do as orthopedic surgeons.
I love what you said, because if you understand what your patient's understanding is going to be of their recovery and what their timeline is going to be, it's one thing to tell them what their timeline is going to be, and they're probably not going to hear it. And they're
Right.
probably not going to think,
Right.
oh, that's what normal patients are going to have.
Yeah.
I'm an elite athlete. That's not going to happen to me. But if you hear it from them and they tell you, oh, this is what I think, this is what I expect my recovery to be, and this is what I'm hoping, I'm going to be back on the golf course in 6 weeks.
Right.
So if you hear it from them and then you're able to reframe and say, that's not a realistic expectation. I really love that that's your approach, because
Yeah.
I think that way you're able to have that dialogue and conversation and understand their motivation and also understand what their expectations are.
Yeah. You think back to our earlier comments around what being an athlete is, or what defines an athlete, what is athleticism, and it is such a huge part of their identity, right? And all of a sudden you have oftentimes a patient, an athlete with no sense of like what the next step is going to be, right? I know that in a normal world, a non-injured world, tomorrow, Tuesday, means this, right? And now Tuesday, they have no idea what to do with Tuesday, right?
Mm-hmm.
So, I think going back to that role of being an educator, and saying this is, and it's funny because, what we're focused on as wanting to educate patients about is not always, to your point, like what they're ready to hear, and we can talk about the navicular cuneiform joint all we want, right? But we need to reframe our education in terms of timeline, in terms of what motivates them, and start to help them, develop a new understanding for what the next, many times 6 to 12 months of their life is going to be like, right?
Yep.
And that has to come in small bites because, I think as orthopedic surgeons, we can be really overwhelming for a lot of patients as we, flood a bunch of, foreign terminology and anatomy on people, and they just want to know, like, am I going to be okay? What are the chances of that? So I think slowing down and segmenting our education into bite-sized moments is an important part of how we communicate.
I really like that, setting the tangible goals of by next visit, this is where we want to be, as opposed to, this is our ultimate recovery road.
Yeah.
Yeah.
And I don't
Breaks
know.
it down.
I don't know about you, Ariel, but I kind of struggle a little bit with what's going on in my orthopedic brain as I look at this X-ray or this exam and kind of weigh its severity, and also I'm staring this patient in the eye and know what a huge part of their identity is really hinging in this moment, and and you're also kind of trying to balance. You've got this 15-minute time window where I want to articulate a lot, and I want to give them a sense of what the severity is, but I don't want to overwhelm them, right? I want to offer hope. I think a lot of the coaches that I consider great in my life were very hopeful people. They were really goal focused, and were able to give me, not only a sense of direction, but a sense of self-affirmation. Like they believed in me, right? And I think our role as orthopedic surgeons is we kind of, if you're buying into that analogy of being a musculoskeletal coach, you are trying to do a lot in a little bit of time, right?
Absolutely.
And it's a tricky mix.
I'm 10 years in and I'm still learning the dance.
Yeah.
I think I'm close, and I get closer every year, but that is a delicate balance of delivering truthful and honest information to a
Yeah.
patient.
Yeah.
Not giving enough information that you're giving the true honest diagnosis without overwhelming.
Right.
Giving hope without giving false hope,
Right.
and without giving misinformation.
Right. Yeah.
And I think it takes everyone's individual in that journey. But
Yeah.
and then you're looking at the clock and knowing that you have, 30 more patients that you still need to see
Yeah.
after this visit. It's tricky.
Yeah, it's funny you mentioned the kind of 10-year segments of our career, and I remember very clearly sitting in a scrub sink next to a partner of mine. I think I was 5 years into practice, and he shared with me as a sports doc that he was today marked his 25th year of being in practice, and I kind of paused in that moment and said, well, that means I can do what I just did 4 more times, right? And 5 years goes by like that,
It
right?
does.
It's just
Yes.
It's fascinating when you think about how we evolve, right, in our ability to communicate with patients and our surgical skills. I think I don't know about you, but when we come out of training, I was just really focused on doing it the way my mentor taught me to, and kind of getting the technical part of it right, and it's funny over time, to kind of think about what you're focused on now. I mean, I'd love to hear, what do you find yourself focused on currently, and maybe in the next chapter of your 5 or 10 year arc. I kind of find myself focused on this notion of how can I communicate better, and I think for me that's the hardest part of our job. I don't know, what do you think?
Couldn't agree more. Not to just agree and not to have something more novel or something more innovative to communicate, but for me, what's comforting is the fact that I do feel like I have the surgical techniques down.
Right.
My team laughs at me because I show up in the morning and I say, "What are we doing today, guys?"
Yeah, right.
Because I don't need to research how surgical techniques anymore.
Yeah.
Nothing intimidates me. I know how to do every surgery, and so there might be a one-off here or there, but when it comes to surgical technique at this point in our careers, we don't need to research before surgeries anymore.
Mm-hmm.
But what can always be improved? Patient relationships.
Mm-hmm.
And so, I always want to be able to deliver the best possible patient care. And so I know now from a surgical standpoint, I can do that. But I think that we can always grow. I think we can always grow as providers in our communication, in our patient experience, in our patient shared decision making.
Mm-hmm.
And I think that we're also growing and learning in that capacity.
Yeah, I find myself, sometimes these days just asking as my first question, what are you hoping to get out of today's visit? Because, as we walk in and we, glance at the X-ray and we glance at the foot, and we're trying to kind of incorporate all these little sound bites of information or info bites, I guess, like right away I'm starting to draw some conclusions about what we're going to focus on today. And it's so funny when you just lead with that, how oftentimes the patient will just, I thought this was going to be a complex talk about whatever I just glanced at on the X-ray, and they just want some reassurance on this totally unrelated part of their anatomy or their foot.
You walk in and you see end-stage ankle arthritis, and you're like, "Ooh, I'm going to do an ankle replacement in a couple weeks," and then they're just like, "I'm here for my plantar fasciitis."
Right.
And if you didn't take the time to ask, you wouldn't
Yeah.
even know how to direct your patient questioning.
Yeah, and I think a lot of looking back at athletic careers, a lot of the great coaches in life, certainly in my life, were great communicators. They could kind of, it is no small task to take a group of 18-year-olds, not to pick on 18-year-olds, and kind of herd those cats into a common goal, and it really was, this balance of, certainly the coach had a goal in his mind, but trying to figure out what motivates, this group of athletes and what do they care about and what do they want. And I think, a lot of those general themes could be analogized into how we communicate with patients, just trying to tap into what they're most worried about.
This is one of my most challenging patients, so I would like to talk to you about it. It's the athlete that's not recovering as quickly as either of us want.
Right.
Because in the back of my mind, I'm thinking, I think we're fine.
Right.
I think we're fine. I think we're just a little bit behind the 8 ball, and I think we'll be fine. But I'm not 100%.
Yeah.
I'm 80%, right? I'm 80% sure that we'll be fine.
Yeah.
And so once again, I want to encourage and I want to give hope, but I don't want to promise in the case that we're not going to get there.
Yeah. No.
Like how do you handle that?
Yeah, that's a great topic, and certainly I don't have a clean answer for that. But for me, the way I get through, I think what you're talking about is uncertainty.
Yes.
And there is so much uncertainty in the world of what we do, right? I mean, to your point, like we think we know what we're doing. We've been trained how to do this. We know how it's supposed to go. We recognize the injury pattern. We can, talk all day long about the classification pattern, but at the heart of it, there are no 100s in our world, right? Like nothing is 100%, and it is such a bell curve of progression that we see as different patients in different ages and stages of their life are dealing with a different subvariant of this particular injury. And, we can map out some general themes, but at some point in a lot of patients' trajectory, there's a moment where it's not quite matching up, right? And what do you do with that? And I think for me, as I try to communicate that uncertainty to patients, it's all about transparency, because I want to know as a patient if I'm in the ballpark. Is this normal? A lot of patients' questions
yeah.
are, is this normal? And a lot of the times we can tell patients that's totally normal. We spend a lot of our time talking patients off the ledge around, things that are foreign to them, and for us it's a Tuesday, right? So numbness or bruising, et cetera, and physical things, but and there's a lot of like psychological normals too that go with the musculoskeletal care experience. The orthopedic blues is a very real thing, right?
Mm-hmm.
When patients are 6 weeks into this journey, and is this normal to feel this way? You bet this is part of it, right? But when they're 12 weeks out or 16 weeks out or 26 weeks out and they're off track, right? A lot of times I don't know why. And I'll tell patients that, say, this is what I expected, and this is what I think. And this, I think importantly too, is why. Why do I think this? And so again, falling back into a role of education, and if we can give patients kind of a handle for this problem that they have, they have a lot of uncertainty. Maybe we as surgeons have some uncertainty, but let's identify it, right? Let's communicate it. Let's put it right on the table. I'm not sure why this is this way. Here's what I think. And you know what? Let's get a second opinion, right? I love kind of leaning on the resources. I feel super blessed, again, to be in a team environment where I've got a lot of great resources, people, way smarter than me in my community, way more experienced than me. And I don't hesitate ever to get someone who's off track and they're feeling the uncertainty, I'm feeling the uncertainty. Let's try to bring some certainty into this. And I think, again, kind of riffing on how what we do analogizes to the world of athletics. Great coaches do that, right? If you think about an athletic team, there's a head coach, but he's got an entire staff around him, and he uses and delegates, his resources, he or she well. And I think that's, what we can do in the world of orthopedics is rely on, if I'm not sure why you're feeling it, I'm going to ask the physical therapist, what have you been noticing over the last 6 weeks, with this patient? And, give me some insight, because we have these little moments where we're trying to, again, assimilate a lot of information and take in a lot of patient emotion and kind of wrangle a plan, out of that. And I think a lot of times I'm, simmering around the edge of uncertainty with some of the things to kind of, forecast what's next. And this is what I think the next 4 weeks is going to look like for you. But I don't know if that answers your question.
It 100% does. And, I think community is so important. I'm the solo foot and ankle practitioner in my group, but
Right.
I have a lovely, lovely foot and ankle community
Right.
in San Diego.
Right.
And so I can not only physically send a patient to someone and know that they're going to get a wonderful supportive opinion, but we have a text message thread.
Yeah.
And we'll just text each other challenging cases. And I'll tell my patients that.
Yeah.
And I'll say, you know what? I'm going to get 5 other opinions for you
Right now.
Yeah.
Yeah.
And I'm gonna ask 5 other smart people,
Yeah.
because the same, I'm like, I think this is fine,
Mm-hmm.
but it's just a little bit off track, and patients are so appreciative.
So responsive to that, right?
And
yeah.
I think it was very old school for people to get offended by a second opinion.
Right.
There's some
right.
sort of ego involved in it.
Yeah.
And I'm just the same. I mean, why not, get a second pair of eyes? Why not, harness in
Yeah.
this other intellect and these other, angles, the other training, these other years of experience
Yeah.
to get the best, possible patient care.
Yeah.
And also to help you sleep a little bit better at night.
Oh, for sure. Yeah, and I think that builds a lot of honesty into the relationship, right? I think we all respond as humans to that, in a really positive fashion. Like I want to know that that yes, he or she has a plan for me, but I also want to know when they're uncertain, and I want to know that they're connected to people who can help, right? A lot of what we do does kind of dovetail and interplay with so many other specialties, right? Whether it's, pain management or certainly our our medical teams around us when we're taking care of patients with rheumatoid arthritis. And there's just a lot on that patient's medical chart that is not in my main bandwidth of expertise, right? And so I need this community around me to, to help me coach or shepherd or forecast for the patients. And it is such a blessing to find ourselves in a space or a community that has those resources.
So you're a bit of a legend. There's a bit of a rumor that you have breakfast with your patients. Can you talk to me about that a little bit?
Wouldn't it be great if that were always the case? Sometimes in life we have a lucky moment. I'm sure you've experienced it where you find yourself talking to a patient and you just have a lot in common, right? Mm-hmm. I think the best days for me in the office are when everything's following the pathway that we predicted, right? But also, you learn something from your patient, and I love that aspect of what we do, where we just have this wonderful window or lens into the broad spectrum of humanity. We see all different types of patients from different walks of life, and there's so much human story, right there in front of us, and a 5-minute orthopedic discussion can then easily turn into a 20-minute discussion on whatever it is that this patient brings to the table. And I did find myself, I think what you're referring to is talking one morning to a patient who just had this incredible life story and a passion around VW buses, and that's always been kind of a hippie fascination of mine. And so we went and had breakfast at a cheap little breakfast joint in town, and took a ride in the bus and had some eggs. And I tell you what, that was the best morning I've had in a long time.
That's that. So it's true. I'm glad that you confirm that the rumor is true.
Well, I just got lucky there. And it is such a privilege to interface with patients, on such a deep level. What we do is occupies this small section of surgical subspecialty, but the themes that we encounter when we talk to patients are so universal, and might hearken us back to our athletic days if we're taking care of an athlete, or might just really resonate on a personal level, as we take care of someone who's really motivated to work, right? I don't know any orthopedic surgeons that aren't super motivated to work, right?
Correct.
And just to kind of riff on that a little bit, when you think about what is an athlete, and to be clear, I'm a community physician, right? I'm not taking care of the Aaron Rodgers of the world, and when I do get the privilege to take care of a high school athlete or a local college athlete, it does kind of bring me back to those emotions that I remember as an athlete, and that's a commonality that kind of connects me to that episode of patient care. But we meet so many occupational athletes, industrial athletes, septuagenarian athletes.
Mm-hmm.
Maybe they are not hitting personal records on speed or endurance or grace, but they are super motivated to get back to what defines their identity, right? Just like the college athlete is. When you think about who's more motivated than a single mother with 3 children who's trying to get back to work after this ankle injury, right? Like, that is the pinnacle of motivation, right? Or
pinnacle of athleticism, honestly.
For sure, sure, yeah. So that's, I always find myself, as a former English major, trying to kind of connect dots and find similarities. And I do find a lot of similarities in the patients that we are blessed to take care of, super motivated. Just got to kind of find what their motivation is, and it's so fun to learn that for people. Yeah.
All right, I'm wrapping up. A little esoteric question.
Sure.
Since you were an English major, I'll use the biggest word I have. All right, if you were at your 25-year mark, like you were at the scrub sink, right? And it was you at your 25 years into career, and you had a piece of advice to give the person at the 5-year into their career as an orthopedic surgeon, what would that piece of advice be?
Yeah, it's great. I would just say relax and enjoy every moment. It is so fleeting, right? And it's funny where we can find enjoyment in what we do. And it's so important to kind of stay focused on that because, you well know these are long hours and at times, stressful pathologies that we're taking care of, and there's the uncertainty that we talked about, and within that, you can, I think, cone your vision out a little bit and just recognize how privileged we are to be interfacing at this very raw emotional level with human beings and practicing, a skill set that has evolved, over such a long, robust history of orthopedics, and there's so much science and technology that we interface with. It's, all those things are super exciting, but I think, at a very elemental level, there's just a lot of enjoyment to be had just talking to someone and just trying to help them make decisions. And I think through my decades, with each passing time segment of my career, I find that the more I focused on that very granular patient interaction experience, the happier I am, and at the end of the day, it can be a whirlwind and there can be a lot of pressures, and but I think moment to moment, if we can find ourselves just kind of relishing that moment of interaction, there's a lot of happy moments in our career.
Tom, it's been an absolute pleasure.
Thanks so much. Appreciate it. It's
so
a lot of fun.
Apparent how much patients mean to you and how much your team means to you. And I think that you are an excellent coach.
Well, thanks for that.
And I've learned a lot today. So
well, thanks for that. Yeah. Appreciate what you're doing. And this is just a great focus. Thanks a lot, Novus, and thanks.
Thank you. And to all of our viewers and listeners, thank you so much. And we will look forward to seeing you the next time.